subscapularis so easily more clearly visible. Condition. And this view is a sagittal direction, sagittal scapularis. So the left hand side, the upper one, side is lower one. So usually that is one of the so the medial, the left side, when we see the and interpreted of the ultrasound is the left side proximal or upper. That's the one of the rule. Not in some cases depends on the structure and orientation ligament, it could be changing. It's a very variable. However, it is better to we have some kind of okay. So that's why usually this is the upper part and this lower part. So this is axial view of the subscapularis near to lesser tuberosity. So as you can see, this asterisk indicates the void of the signal. Originally, we should see the high echogenicity over there. However, in that cases, as you can see, it's very low echogenicity. That means some kind of the pathological condition. So we can interpret it. This structure indicated the tone of the tendon. However, in the lower portion, still high echo. That means still the tendon is okay. So when we rotate it 90 degrees, this is a transverse view of the subscapular, the tendon. This is a lesser tuberosity. In the medial side, this is the lateral side. So as you can see, this is the upper portion of the supraspinous transverse view. Show okay. As you can see, the vacant area over the tuberosity of the humeral head. So that means the vertical tail of the subscapularis. So next one is acromioclavicular joint. The acromioclavicular, acromion and the clavicle. So this is very important, the joint of the shoulder. So we easily detect any kind of degenerative change of the AC joint. If the patient have AC problem, when they move like that, or the pressure under over this area is very painful. Yeah. So we can see we suspect AC joint problem. So AC joint is one of the synovial joints, like knee joints or the other joints. So between the bone inside, some kind of small meniscoid structures. So if the AC joint is degenerated, the meniscoid structures is protruded. Sometimes it makes the swollen bursa, so sometimes make some kind of huge cyst around the AC joint area. So when we try to look at the AC joint, proof on the AC joint spot is very easily to find the location when we palpate the structures. So we move on the superior spinatus tendon. Actually, spinatus tendon evaluation is most important because the pathology of the supraspinatus tendon is most prevalent among the rotator cuff disease. So if the patient has the impingement problem, we call the impingement syndrome. In most cases from supraspinatus tendon problem. So how we make the position appropriately to visualize the clearly of the supraspinatus tendon. So we, in neutral position, it's hard to access view of the supraspinatus tendon. Instead, we try to make the specific posture. We call that the cross the posture position, or the modified cross and the Middleton position. The flexes elbow like that, while keeping the hand placed over the posterior iliac crest and elbow directed posteriorly, like that. So in that cases, the supraspinatus is clearly visualized over here. Awesome. The internal rotated of the shoulder is important, and extended also important. Okay. As you can see, without any that kind of the maneuver, the structure of the supraspinatus is not clearly visible, but however, the shoulder internal rotated and extend, we make the Middleton position. We can see the supraspinatus, the tendon in longitudinal way, more clearly, more large. So there are a lot of the type of the tear that happen in this tendon. So from the partial thickness to the full thickness tear. So in most of the thickness, hair of the thickness is incomplete, but the pathology is going to be worse and worse. The torn tendon is retracted and the tear size increased. Sometimes whole attachment was detached. This is a complete tear. So if the patient have complete tear, the patient cannot elevate it and move the shoulder. We call this kind of the situations is pseudoplegia of the shoulder joint. Okay, so I would like to explain some kind of the cautious things when we examine the shoulder joint around supraspinatus and infraspinatus, like that. So in the normal anatomy, show that the supraspinatus and the behind infraspinatus, some portion is overlapped. So that's why when we examine the supraspinatus in axial view, like that, so in the right hand side you can see the low echoic lesion. You can see the low echoic lesion. So sometimes we misinterpret it. The posterior portion of the supraspinatus is torn. That is wrong. So this is the tendon of the infraspinatus. The reason why, even if the both tendon is
लाहौर में रेस्कॉन 24 प्री कॉन्फ्रेंस वर्कशॉप इस वक्त जारी है।